We've been talking about the case of Steven Martinez. His sentence in the 1998 murder of an infant could be vacated this morning, in part because prosecutors based their case around shaken baby syndrome. In recent years, research around the condition has shifted, and there are now questions about whether this condition was misdiagnosed in the past.
9 News medical expert, that is, Dr. Payal Kohli, with us here to give us a better understanding. So we should start with the most basic of questions. What is shaken baby syndrome?
It's interesting. We're not actually calling it shaken baby syndrome anymore. It's called abusive head trauma.
Okay.
And it's a severe form of child abuse, usually with shaking, but also accompanied with head trauma sometimes that can cause injury to the brain. So if you think about a little infant's brain, their head is much bigger than their body. Their neck muscles are extremely weak, and their blood vessels are very fragile. So if you shake them violently or hit their head against something, you can actually cause bleeding around the brain. That's called a subdural hemorrhage. You can cause swelling on the brain. You can cause bleeding in the eyes. Those are called retinal hemorrhages. And then that can lead to neurological changes and consequences. And it's so tragic because 1 out of 4 babies with it will die. And of the ones that survive, 80% of them will have permanent brain damage.
These stories just make me like physically sick just talking about. Why do you think they're kind of like re-examining these cases, especially from like the 90s?
So the controversy here, Corey, has really come around the fact that does shaking alone cause this degree of trauma? And do you always see the constellation, the triad, those 3 things I mentioned, bleeding around the brain, bleeding in the eyes, and injury or swelling to the brain itself? So if you have just one of those 3, could that still be shaken baby syndrome? Or could it be that the child had an accident? They fell off of something. Right. Could it be that it's possibly something else, metabolic disorder, a bleeding disorder, some other condition that the child has? So I think one of the reasons they're looking again at this is because of that term shaken baby. So there's other mechanisms besides shaking that can cause these kind of injuries. And does that always explain that triad? And do you have to have all 3 findings? Is 1 out of 3 enough? How do you really make that diagnosis? And I will say I'm very surprised, especially in this particular case, that so many years later they're turning it over.
Right.
Because the way that doctors really decide whether or not this is shaken baby is to actually examine the baby in real time. You know, sometimes CTs, MRIs, if the baby is alive, obviously an autopsy, but 27 years later to say that, oh, it was a lung condition that caused her death. And, you know, that the fracture that she had in her brain was a result of trauma she had weeks before, not the shaken baby. It really has me surprised.
Yeah, it was back in 1998, really a long time ago.
Yeah.
Can you talk about some other illnesses or injuries that show similar symptoms?
So, you know, we see mostly this pattern, shaken baby, happening, peaking between 2 and 4 months. And that's usually when babies cry the most and parents get the most frustrated. But we can also see birth injury patterns around that time as well. So if a baby had a difficult vaginal delivery or had some kind of head trauma during that, sometimes that can manifest during that time period. As I mentioned, certainly bleeding disorders. So some babies are born with rare conditions like hemophilia, where they don't clot their blood normally. And so even a minor trauma, such as moving their head very quickly or something, can tear a blood vessel and cause bleeding around the brain and bleeding in the eyes. There's certain metabolic conditions that babies have where their enzymes are not working properly. They don't, you know, process things properly, their sugar and such, and those can also create these types of patterns. And then even things like meningitis or encephalitis. If a baby gets bit by mosquitoes, they can, you know, have brain swelling, they can have lethargy, they can have changes in the eyes, all as a result of those infections. So it's important to rule out any of those mimickers before we settle on shaken baby syndrome.
Is it a different conversation with, I know we don't call it shaken baby, we call it
abusive head trauma.
That diagnosis today versus when you're looking at cases with that back in the 90s?
I think it's a very different conversation. I think I want to be clear that the American Academy of Pediatrics says there is no doubt that abusive head trauma is a condition. That happens often. We have 300 deaths a year from that. That is well established. The question and the controversy really comes, is shaking alone without head trauma enough? And how violent does that shaking have to be? And if you think about it, like I said, because the baby's brain is sort of floating inside their skull and it's a really soft, underdeveloped brain, that has to be a pretty violent injury in order by itself to cause that triad of symptoms. So generally, if they had head trauma and they have those 3 things I talked about, the bleeding around the brain, the bleeding in the eyes, and the swelling, that's abusive head trauma.
I think it's a good reminder here to tell parents, and I remember thinking this because you were talking about those months, I'm sure you do with twins. I can't even imagine. It's hard. It's really hard when they're crying. You can't figure it out. You got the witching hour, right? Like you're exhausted. It can all be hard. The best thing to do is just put the baby down because they're better down in a crib like with a
Safe.
monitor on, safe, than anything else.
Always, because
Yeah.
you do not realize as an adult how much strength you have,
Yeah.
and you don't realize how little force it might take, depending on the baby's age, to really cause this kind of trauma. So I would say even take a walk, go to the other room, do some deep breathing, call a friend, call your partner, whatever it is, but do not ever get into a situation where you find yourself getting worked up, agitated, screaming at the baby, because even things like squeezing the baby, we talk about obviously shaking the baby, but squeezing the baby with immature ribs can cause lung trauma and other types of conditions as well.
I don't know how old you were when you had your first child. I was 33 when we had our twins. And I remember thinking at the time, what I thought of was, I can't imagine having these babies if I was 18 or
Yeah.
19 or even younger for that matter. I mean, I had, just enough patience at 33.
Right.
What would it have been like to have them when I was way younger? So it's definitely something that is worth talking about, something that's difficult to talk about.
Yeah.
But we appreciate you coming on today, Dr. Kohli, to talk about this topic.
Thank you.